As we saw with esophagoscopy or EGD, same way you can do so much of procedures like biopsies or polypectomy. Again, polypectomy is again a popular procedure that is commonly being done by the gastroenterologist. Coming to polypectomy, polyps are benign tumors. You need to know what is the type of polypectomy. Is it a cold biopsy polypectomy or a hot biopsy polypectomy or a snare polypectomy? In a snare polypectomy, the physician employs a device called as a trap-like device and thereby he removes the polyp. At that time, you will have to code for the polypectomy accordingly, because a cold biopsy polypectomy is only a biopsy. You don't have to report the polypectomy at all. Another thing is, when the physician is doing a polypectomy, before that he takes biopsy of the same specimen. You should not report biopsy and polypectomy separately, because here this biopsy is bundled with the polypectomy procedure or it is an incidental procedure. Imagine the patient has a problem in the ascending colon and he does a polypectomy in the descending colon. In this case, you can report the polypectomy of the descending colon and the biopsy of the ascending colon separately, because these are different anatomic sites. One is the ascending colon, the other is the descending colon. And thirdly, control of bleeding. Say for example, a physician is doing a polypectomy and after this procedure there is extensive hemorrhage that occurs, and the physician is doing some methods to contain that bleeding or control that hemorrhage. In that case, here also you are not supposed to report the control of hemorrhage, because that is already included in the polypectomy procedure.